Morning, guys. I've got to start doing more updates. I've had a few people mention about this COVID virus thing. What do I think about it? And a few people have mentioned sort of conspiracy theory stuff, but I'm on the same page, to be honest. I do get the feeling that the money's been dumped into the economies may actually be a bit of quantitative easing going on, for the less polite term from the financial sector. Then in the reality word, it's called inflation. Because what you do is you actually inject more money into an economy. It devalues tangible goods and allows the governments, etc., to actually reduce their debt because the value of that debt in tangible assets has been reduced. I think some of that's going on. It seems very bizarre how coordinated this was globally, because normally I don't expect people to be sitting arguing like a chicken house, with a lot of noise and very little action going on, but it all seems very coordinated. This morning, I was hearing that the railways have been taken over by the government here in the UK, so I'd call that nationalisation, although they'll use other words for it, but they've sort of taken it over on a temporary stance from what I'm seeing, which is also a bit peculiar, but I can also understand it because they've started closing parks and things like that. Well, the parks are obviously controlled by the councils, controlled by central government. They take the railways over, they can shut the railways because it's under the government control. Wherever it's under licensed authorities in the sense of other businesses, they would have to compensate or get in some discussions with these various companies. So there is something a bit strange going on. Now, the whole virus thing, I do wonder where it's heading. Because, you got the UK with old Boris talking a 12-week window of shutting everything down, possible end of the world sort of scenario. And at the same time, Spain's talking about coming out of it on the second week of April. And then you're getting a lot of conflicting information, whether it's affected by climate or not, whether it's even like guidelines coming out aren't the same. I'm hearing that, metal worktops that can survive for up to 9 days, and then someone else will say 6 hours. It's all conflicting. It just seems, very governmental in the sense of it's such a mess. All I can recommend is I think we just got to ride the storm out. Myself, I'm still going to work, but we're sort of restricting our access to other people. I'm quite lucky in the sense I'll be wandering around on roofs and things, so I'm not really going to be engaging too much on a one-to-one basis. Struggle get back to Spain, but Spain's in total lockdown now at the moment anyway, so don't really want to put any unnecessary risks in the sense of going through an international airport is not the best things to be doing when there's a virus outbreak. What does concern me though is the number of cases is quite low, and you'll get a lot of this socialist drivel being pushed around because they're saying that the government here isn't active enough and all this sort of stuff, and I'm sure you're getting it in other places. The government's actually doing its job. What it's actually doing, I don't know what it's doing. From a virus point of view, it is actually doing its job. It's clearing NHS backlog. It's removing unnecessary operations. It's requesting other staff to return to work from retirement, etc. It's mobilising. Now, what I'm a bit concerned about is if you've got Spain saying second week of April, don't worry about it. By the time the UK mobilises, it'll all be over. And yet, you'll also hear people going, it's going to keep coming back and it's going to be an ongoing problem. It's going to be this, it's going to be... A lot of this is just hearsay currently. It's like the flu. The flu is seasonal. Now, yes, it comes back yearly, but guess what? So does your immune system adapt and develop and improve over time. It's the same as other people complaining that people are selfish because this affects mainly the older people and those with underlying health conditions. But at the same time, it's the healthy that are putting themselves at more risk. They're running the hospitals. They're doing the deliveries from Amazon or whatever. They're the people that are actually keeping things running. So my personal view is I can't see the point of being in complete lockdown. I just think people need to use a bit of common sense. I mean, self-isolating if you're in a house where you've got older people or people that have got health conditions makes sense. But if you're in a environment where that's not really an issue, such as the military that's been mobilized in places like Spain, where everybody is of a certain age, etc., and health, then do they really need to be self-isolating or going that extra mile? I don't really think so. A lot of this stuff is basic hygiene. You know, wash your hands. A lot of people don't do that these days. It's just basic stuff. That's what's funny. It's like this MSRA virus stuff that gets pushed is, in the NHS, which kills people. The word for it is dirt. Dirt and dirty people. There's something bizarre. I do find it frustrating myself because it does seem that this virus is being over-egged. I do think that there'll be pharmaceutical companies about to make billions over the next few months. And I know in the US they've already started their first human trials. They've skipped the animal testing and jumped straight to testing on humans. I do know that China's on about having its vaccine within probably the next 2-3 weeks, which is unprecedented. And yet nobody even questions why they can have such a quick turnaround. And then you get other media saying it's got 12 to 18 months away. Well, the problem you get with, cures and that eureka moment that sort of is a breakthrough, is it's a bloody breakthrough. There is no timeline on a breakthrough. What you do have is an expectation, which is why I'm sort of sitting there going, how can they say it's going to be this far away? They've been trying to cure cancers for, since they discovered what cancer was. So I can't see it being a massive breakthrough unless they already know how to cure it, which is a bit concerning. Which means I'm like most people, just wondering what is really going on. And one of the things that nobody really talks about, which is the reality, is most people don't trust their own governments. There's very, very little trust in their own governments. And I know there's this whole New World Order type thing that people believe exists as well. Not asking for that in the comments. I don't really want the people ranting about New World Order stuff. But the point being is, globalization generates large corporations. Large corporations constantly merge and absorb others. So you do end up with these massive, massive conglomerates. They just keep sucking up the world. But whether there's a conspiracy theory in there, until I see hard facts, I'll leave that out to the jury. But yeah, I think a lot of the problems people are complaining about people not listening to the government is because people don't trust the government. The media has been destroyed. The media now is just a circus of entertainment. So you get people's opinions over fact. In fact, more opinions get seen than probably facts. The reason being is you can make lovely stories that millions of people will read where the facts are a bit dry and boring from the medical journal or whatever. So all the media's messed up. People haven't got information they can trust. So what do they expect? But nobody's even talking about that fly in the ointment because that affects everyday life. I mean, the manipulation for the Brexit, the manipulation in the Trump election, the manipulations that have been ongoing in the internet world, but also through the tabloids, things like Facebook and other social media aspects, pretty much says there's a problem with our whole social aspect and media reporting. So I'll leave that there. What else did I want to say? There was something else and I've completely forgot it. But the main thing is, guys, keep well, keep safe. I do think the stuff about the temperature may be actually true. Oh, that was the other thing. This virus didn't start at the start of this year. Now, maybe somebody knows something I don't, but I'm sure the doctor that was the whistleblower blew the news in December, and he had already been treating people in December. So had he been treating them for the month earlier as well? Because here in the UK, over the winter, myself and many of the people I work with had a really, really bad flu. It was on your chest, it was difficult to breathe, and it was very, very difficult to get rid of. It took me probably about 6 weeks to remove it. So the point being is, I wonder if it's already been spread around since sometime last year. And nobody's even talking about that bit, because it was all a bit convenient after the whistleblower. Oh, we've got some cases now. Well, I think they had cases last year and just nobody's really talking about the fact. And the fact is, I think if you're over in a reasonable health condition, you could probably walk it off. In the sense of, give it 6 weeks, I recovered from it. Now, don't get me wrong, I'm not saying I had it, but it just seemed that was one of the worst flus I've ever had, and it just seemed to be very convenient around the same time, and other people have said exactly the same. So I do wonder if it had already been going around the circuit. Because remember, I fly back to Spain regular, so I'm at international airports a lot more often than most people. So the odds of catching it early is quite high. But on top of that, not saying I spread it, it was me that spread it around the office, by the way. I picked it off somebody else. Main thing, guys, I do think hot drinks, this is my personal opinion, because obviously I'm not a medical doctor and the information out there is very difficult to trust. My personal view is temperature makes an issue. Why do I say that? Well, look at the statistics. Look at Pakistan, look at India, Saudi Arabia, look at the cases and fatality rates. The reason I say that is I think that the warm temperature has an effect on this. So keeping yourself warm, keeping the space you're living in warm, may actually be to your benefit. Drinking lots of hot drinks, another one that may be beneficial. Keeping your hands clean, keeping some hand sanitizer if you can get your hands on it is also important. One of the things I've started doing today is actually wearing gloves. Now, don't get me wrong, I'm not wandering around with bloody medical gloves on. I'm just wearing normal gloves. Is it porous or not? No idea. But at the same time, I don't shake people's hands generally anyway, because I don't know where their hands have been. But just reduce your contact with people. And if you can do that, I think you're on the right path. And if you are worried about health, do self-isolate. I mean, we've got the technology now. Amazon's still delivering from what I see, because I've ordered a drum kit for Zoe. So unless you need to go out, I would say avoid other people. To be fair, I was out at the park yesterday. And it's quite funny, you see these people going, well, I took my kids out of school. You people are unresponsible. You're blah, blah, blah. And it's like, yeah, but I was walking on my own. So, to be fair, the park was full. But a lot of these people would not be self-isolating because they're families anyway. So the point being is they are family groups. So there would be, self-isolating in their house? They're going to self-bubble wrap? So the point being is, the park was actually full yesterday. I know a lot of people were talking about the coast was full of people, but the other side of this is what happens when the government can't be trusted. Because if you've got no trust in the government say you must isolate, you must do this. Everyone goes and does the complete opposite. So they all went down to the coast because they're expecting to be moved into quarantine. So that means that the risk of the virus is less than the worry of being quarantined for a month. So the point being is, people are more concerned about getting down the coast while the weather was nice than the quarantine. Now, that just tells you there's a problem with the communications with the government and the trust in the government. Because if people wanted to go out, and they did, it's because they're expecting a lockdown this week. I suspect by the end of this week, we're going to see a lot more tighter measures in the UK. The nationalisation of the railways that's occurred today is a prime example. I think it was on Friday, the pubs and public areas were starting to be locked down. The parks were starting to be shut down, I think, on Saturday. They're phasing it in. But anyway, keep safe and be good. Hopefully see all of you on the other end. Bye for now.